Thank you so much for the opportunity to be here. As Mike said, my name is Kirby, and I'm an occupational therapist and a faculty member here in the College of Health. My research focuses on autism, and the work that I've been doing has really been following the priorities of the autistic community to try to make real-world impact on the community. So last week, the CDC released the latest report of the prevalence of autism among 8-year-old children. And over the last 20 years, we've seen these numbers rise. So the current report is 1 in 44 8-year-old children are diagnosed as being on the autism spectrum. And so when some people see these rising numbers, they think this is a growing problem, or even this is an epidemic. But what I want to talk about is how these bars represent a community of people who have unique needs, and a community who we now have growing awareness of, since we believe this growth over time is due primarily to broadened diagnostic criteria, as well as increased awareness and training. And I want to tell you about how I came to do work with this unique community. So back in 2000, when the CDC first started tracking rates of autism in the country, I was a high school student working at a summer camp teaching swimming to children with disabilities. And it was there at that summer camp that I first had the opportunity to get to know and work with children on the autism spectrum. Autism is a neurodevelopmental condition characterized by differences in social functioning, communication, and behavior. Some characteristic signs we often talk about are things like decreased eye contact or repetitive behavior such as flapping hands. And so at that time, 20 years ago, the primary clinical and research efforts were focused on, I think, what could be considered trying to fix autistic children. So at that time, I was taught to try to really increase their eye contact and tell them to keep quiet hands. But as I was working at the summer camp, what I realized that was none of my training had showed me and taught me that autistic people have a lot of unique strengths and abilities as well. And so because of that dominant narrative, all of my trainings focused on the challenges. And really, I got taught I should be telling them to keep increased eye contact and keep really quiet hands. But I really wanted to kind of think about the strengths and the diverse interests and abilities that I was seeing among the campers that I was working with. And so it was working at this camp that made me interested in pursuing a career working with people with disabilities. And I wanted to find a career where I could do things a little differently than I had been trained. And so I found the career of occupational therapy. And I will just pause for a moment because I know the title of occupational therapy is often confusing. We do not provide therapy at your job to help you like it more. Instead, we have a broader definition of what occupation means, and so occupational therapists are really concerned with helping people better support their occupations, and that means anything that occupies our time, the many things that we all want to or need to do in our daily lives in order to fully participate and kind of have meaningful engagement. And so I found through occupational therapy that I could work with autistic children to help support them to participate in meaningful activities while also helping them enhance their strengths and caring about what they were interested in and helping them kind of focus that way. But alas, as I worked as an occupational therapist for a few years, I started to wonder what we could do better, what we could do differently, and I became interested in pursuing a career in research. So I attended the University of North Carolina at Chapel Hill and had the opportunity to work with Dr. Grace Baranek there. And her lab really focused on understanding sensory experiences of children on the autism spectrum. So I remembered back to all my experiences at the swimming pool where I was teaching children at summer camp. And I knew that a lot of the children that I worked with had really negative reactions to the various sights, sounds, smells, and textures in their environment. But then there were also children who were really seeking out intense sensory experiences, wanting to kind of get the most out of their environment, and seem to find those experiences either calming or enjoyable. And one of my favorite studies that I got to work on at UNC was a study where I got to interview autistic children themselves about these sensory experiences, to hear from their own voices what it was like for them to engage with these various sensory inputs in their environment. And I found that I really was drawn to studies like this, where I got to hear the perspectives of autistic people and their family members. And ultimately, I've allowed those perspectives and these kinds of experiences to drive my research agenda. So of course, what that's meant has been that my research trajectory has not quite been a straight line. I've kind of taken things and hear new things, and I kind of take turns. So while I was doing this work, understanding sensory experiences for children on the spectrum, I kept hearing from parents how worried and concerned they were about what's going to happen when my child grows up, what's going to happen when I'm gone. And so really thinking about the transition to adulthood and being able to be a successful autistic adult in society was really important to families. So I began to explore some of the experiences of adults on the spectrum. And I found that there wasn't a lot of research, but what we did know was there was a lot of difficulty finding and maintaining employment, building and sustaining successful social and romantic relationships, and experiencing things like stigma and discrimination. And as I said, adult-focused research in autism has really been the minority of studies. And so there's a huge need to better understand the needs and experiences of autistic adults. So I've had a really great opportunity a few years ago to join, it was a brand new journal at the time called Autism in Adulthood. And I've been an editor on their team since the start of the journal. And in that role, I've been able to really help shape the future of autism research, which has been really exciting. And one of the things about this journal that's especially exciting is that it really has aligned with my interest and desire to listen to community members. And so, in fact, in addition to the traditional scientific peer review process, we send every manuscript under review to an autistic adult for their review. And we invite them to share whether they think the research is important, whether the article is written respectfully, and they're offered, they can offer suggestions to the authors to further strengthen the work. Then, as I was doing adult work and focusing my dissertation and my early faculty research on the transition to adulthood and supporting autistic youth and families in that process, I heard something new that ultimately resulted in me taking kind of another detour on my research path. So while I was interviewing one of the first parents in my dissertation study, I asked a mother, what do you envision for the future of your teenager on the spectrum? And she told me, well, I think he will. He has the ability. But last year he became suicidal, seriously suicidal, and he was hospitalized twice. And it turned out I was not the only person surprised by this. Autism professionals at that time were not thinking about suicide risk in the autistic community, and yet we were hearing it from family members. In fact, many professionals who worked with people on the autism spectrum actually thought that autistic people might be at lower risk due to their social differences. And so this became an aha moment for me to really decide I wanted to learn more about this important area. So I was really fortunate here at the University of Utah to get connected with mentors in the Department of Psychiatry who had done autism research in the past, but also were experts in mental health and suicide. And they helped me bridge these two things together. So with their support, I applied for and received a KL2 grant from the Utah Clinical and Translational Science Institute. And that really allowed me to initiate my training and development in this new area that I didn't have any familiarity with, autism risk among, suicide risk among people on the autism spectrum. And so together we published the first population-based study in the US looking at suicide risk in an autism population. And we found that autistic people in Utah were at significantly higher risk of dying by suicide than the rest of the population. And this was named a top autism research study of 2019. And after I published this study, I heard from even more autistic people and their family members about how important this topic is to them. And one of the things that really stood out to me is that many of them shared with me that some of the efforts that they had experienced earlier in their lives, such as trying, again, those ideas of trying to fix and change their behavior, had really had a negative effect on their mental health. And interestingly, I'm also starting to hear about how things like sensory overload and difficult transitions to adulthood are also factors that are negatively impacting autistic mental health, sort of linking all of my research areas back together. So now I'm continuing to do work in this area. I recently received a K-23 grant from the National Institute of Mental Health, and we will be conducting work to better understand suicide risk among autistic people and building towards enhanced community understanding and community education towards suicide prevention for autistic people. And further building on my interest in listening to the community, this study is actually going to go even further and partner with autistic people using community-based participatory research approaches. And I'm partnering with an existing stakeholder group called Aspire, and I have additional mentors supporting that area of my development as well. So it's really exciting that I'm able to kind of develop in this area to partner with autistic people and also at the same time be able to advance the science of what we know about suicide risk and suicide prevention in this area that we know is really important to the community. So because I like to follow the kind of beat of what I'm hearing from the community, I don't know all the future directions that my research may take, but I know I want to continue to listen and learn alongside autistic people to advance autism research. So I really appreciate your time. Thank you.